Hi everyone. Today's lesson we're going to be going over ballet, point ballet, and the physiology of what's going on in your foot. And the real important part of this is for my young dancers that are starting point or the ones that are getting more advanced in their point. I want you to understand this because this is going to help you understand why you're going to do the home care and exercise daily to keep your feet and your legs healthy for the dance. So just a little history that I've been learning about point. Marie Taglioni, back in 1831, she's the one who kind of started doing the point, and it was an amazing form that made her look like she was floating across the stage. From then, there's been developments, and I'm learning the history myself right now, and it keeps advancing and the evolution of dance for the point work. This is a neat little video on YouTube. It's called Ballet Evolved. It's put on by the Royal Opera House. You should watch that if you're just starting point or if you want some history. So let's go a little bit into the physiology of your foot. This is a three-dimensional model of your foot, and I'm going to remove the skin layer, and you can see that you have an amazing supply of nerve that comes down, and you have all these different muscles that come from the calf muscle and the Achilles here, and they start to go down into this area that turns white. Now that white area is what we call a tendon. So a tendon is a transfer from a muscle to a bone. So that's what it's going to attach, that muscle that's going to help a joint move, and it's going to attach onto a surface of the bone. The red part is your muscle, of course, and some are bigger than others, and some have more blood supply than others. So let's get into the foot. So this is the inside of the foot. This is the outside of the foot. This is the top of the foot. And the important muscles to know about in the point is underneath here. This is called abductor hallucis. This is a muscle that helps the foot grab and curl those toes in. Okay, and I'm going to go underneath the foot now. And you're going to see this is what they call plantar fascia, which supports the bottom of your foot, the structure of the foot. I'm going to take that layer off. And you can see how the tendons kind of run and then they go to your toes here. And so the real important part of this is, where do those tendons come from? Because that's what you're really going to work on at home care. The feet here, you're going to really work on the strength in the feet, but we're going to work on those tendons because that's where a lot of stress builds up for the point work. All the stress kind of gets into this area, and I have a lot of dancers that come in that will have pain, especially in this area of the back of the foot on the inside or right underneath the foot in here. And a lot of times they're like, well, why are you working up here in the calf when I have my pain down here? Well, if you can see here, the tendons run down here, but that's not where they start. We're going to go after the muscle that you can have more of an influence at home and get that to loosen up. Think of slack in a rope. If you tight the rope really, really tight, and that rope up here gets really tight, now where it inserts down in the foot is going to get really tender if there's too much tension. Or if you're dancing a lot and you're not recovering right, that tension is going to grow more and more and cause pain down here. So let's get up into the calf here, and I'll show you how to do some work on that. We're going to remove another layer. This is the muscle group here. Perfect. Okay. So here we are, and this is now getting into the calf muscle. Now you can see here, I'm going to add another layer. This is the calf. You have a soleus here, and then you have the big muscles here. If you look at a professional ballet and they have those big muscles on the back of their calves, that's called the gastrocnemius here. Those are power muscles for going into what they call plantar flexion, or pointing the toes down. Let's take that layer off, and now you have the soleus, and with the gastrocs and the soleus combined, now you go down to the Achilles tendon that attaches on a bone here called the calcaneus. So that's going to really create a lot of your power and a lot of the point work. On the front of the leg, you have the tibialis anterior, what they call it, and some of the peroneals here to keep your foot in position. Those are supporting, but they're also very important to this. So when you're doing muscle work at home, we're primarily going to work on these muscles here. Take another layer off. Oh, and you can see there's muscles hiding in there as well. Now for the pain of dance, I say pain of dance, but when dancers get a lot of pain on the inside of that foot, it's because of, most of the time, a little muscle in here that brings that foot, and especially the toe, into point. And so you can see that tendon that runs from the muscle here, it comes on the inside of the foot and it runs all the way down and it attaches right onto the toe. Now if you look at the dance itself, let's watch this little video here, you're going to see how she's on point here. And what's keeping that toe down like that? That's a combination of what the calf muscles are doing here, and also how that toe is able to keep in the point right there. Okay, so that's a little physiology. Now what's really important about this is, let's say that we're doing a tremendous amount of point work, and you're getting these muscles all nice and tight and they're getting strong, but we're not working on the flexion part too, or not recovering. This will get really inflamed in here, and when you start to overdo the point and then you're not working on the flat or the stretching part after dance or the recovery at home, this starts to get really irritated in here, and that can cause some inflammation. So that's why we want to do your foam rolling, your exercises, and all of the warm-up to keep this nice and healthy. So I hope that helps you, or I hope that helps you a little bit on learning a little bit more about point. We'll go over more details on the foam rolling in a future tutorial, but that's the physiology of your foot.